Hi, welcome to this segment from the Calcium Therapy Institute. Today, what we're going to be talking about is something many of you have probably seen and are familiar with, and that is you've seen people that have this gap between their teeth. There are a number of actors and celebrities and maybe people that you just know who have this, and sometimes we regard it as it's cute. It's something distinctive and that sort of thing. We'd like you to know a little bit more about this. It's called a diastema. And this is what a diastema is. It's an infection. It's a cyst. And it usually means there's a dead tooth involved. Now, here at the Calcium Therapy Institute, Dr. Manhart has been working with diastemas for almost 40 years.
Oh, Sam, I'm sorry.
Well, glad you could join us.
Well, the traffic, in Omaha, the traffic's really terrible.
That's true. There are some great billboards. I'd like to show you one later.
Well, good,
Yeah.
good.
Talking here about diastemas, this gap between the teeth.
Yes, got it.
That you have so much experience with. So, there's actually a therapy for this that you have developed, right?
Yeah, sure. What do you call it? Osteoendocystic therapy.
That's it. Yeah, that's the one.
It's a bone, it's a root canal, and there's a cyst, and it's treatment of it.
Well, that sounds like a lot. Let's talk about some of that.
Okay. This is really terrible of me to come in late like this.
It's quite all right. Look, we pinched some of your X-rays here.
Yeah,
we'd like you
I
sort
know.
of to explain sort of what's going on here with some of these. I believe these are the same things you actually show patients when you're working with them.
Well, this is a series of a couple cases here where the space is there, and it took a year for us to, the space is there, there's infection here, and we brought those teeth together and cured the infection. And here there's infection, there's a root canal that's been there forever, but things were all infected, and we treated it, and the root canal got better, and the infection got healed.
How do you treat it?
Well, you got some more slides, I'll tell you.
Okay. All right.
You treat it with calcium, and
These are different cases, I
yeah.
believe.
This is an ideal case for explaining to people. And so this is what I explain. You look at this, and when we show this to people, almost everybody that looks at it, they see this dark, and they say, what's that dark area?
Right.
Dentists, I've shown that to hundreds and thousands of dentists, and they look at it and they say, well, we got a filling here and a filling here, this tooth's all fine, and then we got this crown here, and everything's okay. Well, guess what? If everything was okay, why is it when we tested this teeth for vitality to see if it's alive, this teeth was dead?
So it looks okay in the X-ray.
Yeah, like didn't you say something about this gap? And
Yes, the gap, yeah.
Yeah, and people see it all the time. You got an X-ray on that? You might show later. You do?
I think so, yeah.
Anyway, the dentists don't see it. You know why? Because the dentists see it all the time. And so if you see something all the time, almost, well, it must be normal. Well, if that was the case, why is it this was a dead tooth that seemed to be just sitting there and fine and had to have a root canal? So we did a root canal. And if this dark area here is innocent and nothing and needs no treatment, why is it that after calcium treatments for 6 months, 7 treatments, the bone has healed? It's a stark difference. On this, it's simple. 27-year-old woman, and she had all of this work done, the root canals, the crowns, and they wanted to take her teeth out because her infection was terrible. And she was just dying with this infection. We saw her and treated right along here, right along the crowns with calcium, and all of this got better. Well, this was 31 years later. That X-ray was taken 6 years ago, at least. And she still comes in and has her teeth cleaned once, twice a year.
And they wanted to take them all out.
Yeah, and she's lost no teeth.
Hmm.
And how do you do that? You treat it with calcium, and you take a look at this in depth.
So, just wanted to wrap up by saying, now you know when you see this gap, what it is. Remember, it's an infection, it's a cyst, it means there's probably a dead tooth there, and that many dentists are missing this. And there's more information available here at the Calcium Therapy Institute about that. And Dr. Manhart has spoken internationally about this in Europe, in the United Kingdom, and from what I understand, it's been well received.
Well, it isn't important to me so much whether everybody received it. What was important at those conferences, they would see it and they would say, my gosh, this is important. We want to learn about it. And I think it's really too bad that in the United States, we're not picking up on it, you know?
Okay.
And it would help all kinds of areas of dentistry. I ought to talk to you sometime about how
All right.
these calcium materials can be used in every field of dentistry.
All right.
You believe that?
Well, I'm eager to learn about it, so we'll do another segment on that, and we just want to wrap this one up for now. And thank you for listening.
Thank you, Sam.